Hello, scholars. This is Janice Bell Meisenhelder. I'm an adjunct professor at Emmanuel College, and this is a class for the course on death and dying. And this is going to be in two parts, so please watch both parts. I have been an academe. I was a full professor at Emmanuel College and just recently retired, but my credentials for this particular class are very different. I am unfortunately a bereaved mother. There's my daughter Melissa, who succumbed to cancer in 2004. I have then reviewed all the literature on bereavement and written a book, Surviving the Unthinkable, the Loss of a Child, which is written for the mind in crisis. So this is written to be given to a bereaved mother as soon as she is hit with that shock. It covers common issues for the first 3 years. It's written in the way that a nurse would write a patient guide for the patient going home. It's in very practical options for whatever circumstances hit her at that time. So she could peruse the table of content and pick out, well, what is she dealing with right now? So this is a book to be given to a bereaved mother. And I hope no one would ever need this book again, but I'm afraid that's not the case. It's easily available on Amazon or on the publisher's website, MBM Publishers. I've also recently published, 2001, published an article in the BMG, Supportive and Palliative Care, which has boxes that tell you this is what healthcare people need to know, this is what mothers need to know. I highly recommend that for your future reading. But what we're going to cover in these two classes is what not to say, because the first thing bereaved parents tell researchers, and I've reviewed all of the research, the first things that they say is this is what you shouldn't say, because people say harmful things trying to be helpful. And then I'm going to tell you in part two what to say, and then an important three-part response. But both parts of this class are really important. So please hang in there. So first of all, why do you need this content? Well, we know that from research that social support, being able to talk to people, is the key to positive adjustment. Research shows us that bereaved people, and not just mothers, but bereaved people who have other people supporting them in a positive way, have less depression, less anxiety, less intense grief, are able to kind of function better in spite of the grief. And lack of that very much impairs the grief process. People suffer more and for longer if they don't have social support. But it's not easy, because in order to support someone who is in deep grief, you have to be willing to enter into that pain. And so many people try to fix it or can't handle someone in pain, and that's what triggers a lot of the wrong responses that are not helpful. So you have to, if you're at a point in your own self where you can't handle someone else's grief, then just send them a note. leave some cookies at their doorstep with a kind note. Like, do what you can do without having to put yourself in a situation that you won't be able to handle. It takes a special person to be able to sit with someone who's grieving and allow them to just feel the pain. So first, what not to say. These negative responses are based on common myths, like the myth of closure. There's supposed to be an ending to grief. And commonly people think, oh, you grieve for a year and then it's over. And I think Freud propagated that based on his own grieving over his parents. Well, that might be very good for a parent. I mean, that might be very common and very appropriate. But if you're grieving over a loss of a child, that longing to see that child again never goes away. There are parts of grief that never goes away. And the problem with the myth of closure, first of all, people tend to encourage closure, which is negative, which is harmful, because it's telling the grieving person they shouldn't be grieving. So it's negative feedback. And then they make judgments based on closure. There is no closure for some grief, and whatever time segment is appropriate for that person and that relationship, that's what it is for that person and that relationship. And there's no hurrying grief, unfortunately. There are no stages to grief. Kubler-Ross did a tremendous disservice, or maybe the people who picked up her work and applied it to grief did a tremendous disservice. Kubler-Ross really was talking about when you're hit with Kubler-Ross did the stages of grief that people commonly apply. And she was really talking about someone who received a cancer diagnosis and then was trying to deal with the fact that their life was going to come to an end. Those stages are actually appropriate there. But when you lose someone, there's a swirl of emotion, and there's anger, and there's guilt, and there's pain, just longing. There's all these different emotions, and they swirl around. They come and go. They have a kind of circular recycling kind of entity to them. Triggers will bring up different feelings at different times without any warning. And there's not a stage. There are no stages. It does get better. It does ease over time. There's certainly a progression to it, but it's not linear. And multiple feelings come up at the same time. So please don't apply any stage or developmental type of framework to grief. There's no right way to grieve. Everybody grieves differently. So some parents who've lost a child can't tolerate looking at their child's photos. It's too painful. They're afraid that they'll actually disintegrate. And other parents just hunger for the photos. They hunger for any kind of reminder or contact with their child. And both ways of grieving are appropriate. Everybody does it differently. So what I tell people is just listen to your instincts. Do what your heart tells you to do. And then there's a myth that you can fix this. And we all want to fix it. We all want to get people out of the pain that they're in. You can't. It's a process that the grieving person has to walk through. There's no avoiding grief. You have to process it. You have to walk through it. And the more the grieving person can get up the courage to just face the pain and express it, the healthier they will be in the long run. So what are some of the characteristics of negative support? Avoiding the topic or avoiding the grieving person. So grieving people feel isolated. One woman said to me, I feel like I have a sign on when I walk into a room, I feel like a sign on my chest saying, I just lost my child. People just avoid me because they don't know what to say. They avoid it altogether, or they avoid the topic. And meanwhile, the grieving person is dying to talk about the person they just lost. It's all they can think about is the person they've just lost and how wonderful that person was. So the best thing to do, and I'm jumping ahead, but the best thing to do is ask the person, what do you want me to tell me about your daughter, husband, whatever? Or I've heard how wonderful your daughter, husband, whoever. I've heard how wonderful they are. What do you want people to know? What do you want people to know about them? What do you want people to know about what you're going through now? Just give them the opportunity to talk whatever they want to talk about. Don't tell anybody who's grieving that you know how they feel. It doesn't matter that you've had a similar loss. Nobody knows how the other person feels. You just say, my heart goes out to you, and let them tell you what they feel. Try to avoid giving advice that's trying to fix it. These are very difficult to avoid, by the way. I've a very hard time not giving advice, but allow the person to figure out what's going to be best for them. I might offer options for people. In fact, my whole book are options. These are things you might try that which one of these do you think might be helpful to you? That's different than giving advice and telling someone what to do. Don't encourage closure. Don't say closure. Don't say time limit. Don't say move on. Move on is awful. People don't move away from grief. They move through grief. And for someone like a parent who's lost a child, they will take that person with them. They will always have that child with them as they move through life. They're not moving on, they're moving with. And that's a very important distinction for people who are hurting. Trying to minimize the pain, and people say things like, oh, but they're in a better place. That's not helpful. Yes, the person may believe they're in a better place, but they're still, the grieving person is still racked with pain, or you know, trying to like distract them. That's not helpful. Withdrawing support too soon for parents is really, really common. Parents actually want lifelong acknowledgement of the presence of their daughter or son. That was a slip. Daughter or son. They want to know that people are remembering their child for the rest of their life. So avoid saying move on or anything that you need to get to closure. It's been over a year. You know, if you're still, maybe you need therapy if you're still grieving. Avoid that kind of judgment. I know how you feel. Stages of grief, you just need to accept this. You need to get the acceptance stage. No, they don't need to do anything except be who they are and process however they are processing. And then the person supporting them just needs to accept them for whoever they are and how they're processing. And then meeting in the lost perceptions, like God takes the best, you have an angel in heaven. Even if the person that you're speaking to agrees with that, they need to be the one to form their own meaning about the loss, not you. And often those kinds of comments are geared to trying to make the person feel less grief, and nothing can make the person feel less grief. So they're not helpful. They're just not helpful. So what have you learned in this? What myth did you think was true prior to this presentation? And have you heard anyone say any of these phrases to avoid? And please watch part 2, in which I will talk about what to say and how to support. Thank you so much.